we proceed with the Secretary of State's statement, I would like to remind honourable members that the conduct of another member should not be criticised on the floor of the House other than by a substantive motion. I now call Secretary of State Matt Hancock to make a statement. Secretary of State.
Thank you very much, Mr. Speaker. And with permission, I'd like to make a statement on coronavirus. The virus is spreading both here and overseas. In the last week, over 450,000 people tested positive for coronavirus in Europe, almost double the number of cases a month ago. And here in the UK, the number of hospital admissions is now at the highest it has been since mid-June. Last week, the ONS said that while the rate of increase may be falling, the number of cases is still rising. Yesterday, there were 12,594 new positive cases. The rise is more localised than first time round, with cases rising particularly sharply in the northeast and the northwest of England and parts of Scotland, Wales and Northern Ireland. Now more than ever, with winter ahead, we must all remain vigilant and get this virus under control. Mr. Speaker, I now want to turn to the operational issues on data publication and the future plans for medicine licensing, and of course the announcement of 40 hospitals made by the Prime Minister on Friday night. Mr. Speaker, I want to take the first available opportunity to set out to the House the technical issue around case uploads discovered by Public Health England on Friday evening. This is an ongoing incident, and I come to the House straight from an operational update from my officials. On Friday night, Public Health England identified that over the previous 8 days, 15,841 positive test results were not included in the reported daily cases. This was due to a failure in the automated transfer of files from the labs to PHE's data systems. I want to reassure everyone that every single person who tested positive was told that result in the normal way, in the normal time frame. They were told that they needed to self-isolate, which is, of course, now required by law. However, these positive test results were not reported in the public data and were not transferred to the contact tracing system. I want to thank colleagues who've been working since late Friday night through the weekend to resolve this problem, and I want to set out the steps that we've taken. First, contact tracing of these cases began first thing Saturday. We brought in 6,500 hours of extra contact tracing over the weekend, and I can report to the House that as of 9 a.m. today, 51% of the cases have now been contacted a second time for contact tracing purposes. I want to reassure the House that outbreak control in care homes, schools and hospitals has not been directly affected, because dealing with outbreaks in these settings does not primarily rely on this particular PHE system. Second, the number of cases did not flow through to the dashboards that we use both for internal and for external monitoring of the epidemic. Over the weekend, we updated the public dashboard, and this morning the JBC presented to me their updated analysis of the epidemic based on the new figures. The Chief Medical Officer has analysed that our assessment of the disease and its impact has not substantially changed as a result of these data, and the JBC has confirmed that this has not impacted the basis on which decisions about local action were taken last week. Nevertheless, this is a serious issue which is being investigated fully. I'd like to thank Public Health England and NHS Test and Trace, who've been working together at speed to resolve this issue, and I want to thank everyone for their hard work over the weekend. Mr. Speaker, this incident should never have happened, but the team have acted swiftly to minimise its impact, and now it is critical that we work together to put this right and to make sure that it never happens again. Mr. Speaker, another important area of our coronavirus battle plan is treatments. As the House knows, the only treatment known to work against coronavirus was discovered here in the UK. And as we leave the EU, I want to use the opportunity to improve how quickly we get new drugs to patients here. So the UK is joining with Canada, the United States, Australia, Switzerland and Singapore in Project Orbis, which will allow international regulators to work together to review and approve the next generation of cancer treatments faster. This means pharmaceutical companies can submit treatments to be reviewed by several countries at the same time, so we can cooperate with the best medical regulators in the world and make approvals quicker so we can get patients the fastest possible access to new drugs. This is an exciting development, and we'll join this scheme fully on the 1st of January after the end of the transition period, because we'll stop at nothing to bring faster access to life-saving treatments on the NHS. Mr. Speaker, we're investing in our hospitals too. And 2 weeks ago, I announced to the House that we're investing an extra £150 million in expanded capacity in urgent and emergency care, so hospitals have the space to continue treating patients safely in the pandemic. On Friday, I'm delighted that my Right Honourable friend, the Prime Minister, set out the 40 hospitals that we'll build by 2030 as part of the package worth £3.7 billion, with 8 further new schemes invited to bid for future funding, also to be built by 2030, including mental health facilities. This is the biggest hospital building programme in a generation, and the investment comes on top of an extra £33.9 billion a year that the government will be providing to the NHS by 2023-24. We passed that into law right at the start of this Parliament, Mr. Speaker, and these 40 new hospitals across England will support our mission to level up our NHS so even more people have top-class healthcare services in their local area, and so we can protect the NHS long into the future. Finally, Mr. Speaker, it's critical that our rules are clear at a local level so that the public can be certain of what they need to do to suppress this virus. And I'll update the House in due course on what action the government's taking so we can have more consistent approaches to levels of local action, working with our colleagues in local government. For now, it's essential that people follow the guidance in their local area, and if they need to check the rules, they can check on their local authority website. Mr. Speaker, history shows us that the battle against any pandemic is never quick and never easy. It requires making major sacrifices and difficult choices. And I know that this has been a tough year for so many, and that we're asking people to persevere as winter draws in. Because the only safe path is to suppress the virus, protecting the economy, education and the NHS until a vaccine can make us safe. And I commend this statement to the House.
Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement. Now, Mr. Speaker, in recent weeks, we've had people told to travel hundreds of miles for a test. We've had hundreds of children out of school, unable to get a test. We've had tracers sitting idle, watching Netflix. We've had care home tests taking days to be processed. Yesterday we had a health minister saying this could be a moment of national pride like the Olympics. We've had a Prime Minister in a complete muddle over the rules. And now, at one of the most crucial points in this pandemic, we learn that almost 16,000 positive cases went unreported for a week. That means as many as 48,000 contacts not traced and not isolating. Thousands of people blissfully unaware they've been exposed to COVID, potentially spreading this deadly virus at a time when hospital admissions are increasing and we're in the second wave. This isn't just a shambles. It's so much worse than this. And it gives me no comfort to say it, but it's putting lives at risk. And he should apologise when he responds, Mr. Speaker. Now, no doubt he'll complain about my tone or say he won't have any divisive talk, but people want answers. Now, he's just said that over half of the 16,000 people have been spoken to by tracers and presumably handed over their contacts. When will the other 49% be spoken to by contact tracers? How many of the contacts have now been traced and spoken to, and how many are isolating? Why did nobody notice this issue until Friday night? Why did it take until 9:30 on Sunday evening for this to become public? Because clearly the Prime Minister was aware of the problem, because he said on MAR yesterday morning there has been a, quote, failure in the counting system, now rectified. Now, speed is of the essence when dealing with a pandemic. So when were local directors of public health informed? He says this is an ongoing issue, so not rectified, as the Prime Minister said on MAR. When will it be fully resolved? Public Health England sources say they report the data when they get the data from Test and Trace. So can he confirm that data could not be handed over to PHE because of the size of the files, of the Excel spreadsheet files? And was this an issue at one particular lighthouse lab, or is it across all the lighthouse labs? And why are critical databases in a national pandemic hosted on Excel spreadsheets? Why aren't they using specialist database software? Now, he likes to boast of his background in software development. So did he sign off this system? Was he aware of it? The Department of Health is responsible for the integrity of Pillar 2 testing data. His department is the data controller. So he is ultimately responsible for this mess. A mess that is made up of the fragmented systems passing data back and forth between his department, PHE, and outsourcing companies like Serco and Deloitte, and it's costing us £12 billion, Mr. Speaker. Surely now is the time to not renew Serco's contract and instead give responsibility and resources to NHS labs and local public health teams to deliver testing and tracing, Mr. Speaker. Now, he says the data does not impact on decisions that have been made about local restrictions, but areas already under restrictions like Bury, Hyndburn, Burnley, Manchester, Liverpool and Newcastle have seen increases as a result of this data. Will areas like these and others under restrictions now be given extra help and resources to battle this virus? And other parts of the country, not under restrictions, are also climbing higher with this new data, such as Newark and Sherwood. So should we expect more local restrictions this week? I notice he says he's set to bring in a new free-tiered system to replace the confusing network that's in place now. Will he update the House on what the new criteria will be for an area going into restriction and what the criteria will be for leaving restriction? Because so far, it's been a bit like Hotel California. You can check out, but you can never leave, and families deserve answers. Mr. Speaker, the Prime Minister told this House on 20th of May we would have a world-beating system in place by June. It's now October. The system is neither competent nor improving. Problems are getting worse. The government is failing on the basics. When will he finally fix this mess?
Stay.
Well, thank you very much, Mr. Speaker. Just to answer a couple of the factual questions, as I said in the statement, we now have, as of 9 a.m. this morning, 51% of these cases have been contacted by the contact trace system, and their contacts are contacted immediately after that initial contact, so concurrently. The question that he asks about the tiering system, absolutely there'll be extra support that goes to areas where there are an increased number of cases. And he asks about the criteria in this proposed approach. Of course, you can't have a fixed and specific criteria because it depends on the nature of the outbreak. For instance, an outbreak in one individual employer, you wouldn't necessarily then put the whole local area into local action. And so sometimes there has to be, all the time, we try to make the intervention as targeted and as localised as possible, but obviously sometimes it does need to be broad, as he mentioned, in the northwest and across large parts of the northeast. And one example is that the intervention in the West Midlands covers 4 of the 7 council areas of the West Midlands, but not the other 3, because that follows the data. He also asked me about the particular IT system in question. The problem emerged in a PHE legacy system, and we had already decided in July to replace this system, and I commissioned a new data system to replace the legacy one, and the contracts were awarded in August, and the work on the upgrade is already underway. So whilst of course we have to immediately change and solve the problem, we also need to make sure we upgrade this system, and we'd already put in place the contracts to ensure that that is happening. In the meantime, of course, it is critical that we work together to fix these issues that were themselves identified by PHE staff working hard late on Friday night. And I want to thank the PHE staff who've done so much working to resolve this issue over the weekend. And of course, in the answer to the final one of his questions, we need to make sure that we get through and get to contact trace all of those cases as soon as possible. In 2 days, we managed to get to 51% of them, and that work is ongoing today.
Committee, Jeremy Hunt.
Thank you, Mr. Speaker. The Health Secretary deserves enormous credit for the expansion of testing capacity, which he has personally championed. But isn't the underlying problem here that the Lighthouse laboratories have been overwhelmed by demand and are going to continue to be overwhelmed? And so do we not need to think about the structures, and in particular whether the responsibility for NHS staff testing and care home staff testing should be moved to hospital laboratories and universities in a way that was advocated this morning by Sir David Nicholson, the former Chief Executive of the NHS? Can I urge him to think about whether sometimes it's tempting to think that just by dealing with this latest problem you're going to solve the whole problem, but this is a situation ahead of winter, ahead of the second wave, when we do need to think about whether these structures are right for what we have to deal with.
Well, the expansion of the NHS testing is, of course, critical as well, and the system in question where the problem was over this weekend is a system that brings together the data both from the NHS systems and from the so-called Pillar 2 systems. So that is the challenge was in a system that integrates the two rather than in just on one side or the other. But he makes a broader point, which is that as we expand the NHS's capacity as part of the overall expansion of testing, we have to ensure that we use that capacity to best effect. And many places, many parts of the NHS, increasingly, it's NHS testing capacity that is used for NHS staff testing, and that is a system that works well because the test is local and convenient, and we're looking to expand in exactly the sort of direction that he outlines. But I would urge colleagues away from trying to bifurcate between these two systems. Essentially, we have a whole series of different ways to access a test, and we need to make sure that people get the tests that are the most easy to access for them as much as possible.
Video link. Dr. Philippa Whitford.
Thank you very much, Mr. Deputy Speaker. The delay in almost 16,000 COVID cases being entered into government databases has resulted in last week's case numbers being totally inaccurate. The Secretary of State says the updated statistics would not have led to additional measures, but are there any new areas of heightened concern? PHE have blamed the problem on test result files being too big to load onto their central system. Was this, as has been suggested, due to the transfer of data between formats? And if the underlying issue was due to the rapidly rising number of positive cases, why was this not anticipated or identified sooner? And can he be sure that something like this can't happen again? Just as importantly, it means none of those cases were registered with the tracing system. And while, as he says, people with a positive test got their result, and we hope self-isolated, they didn't get direct advice and they did not give the details of their contacts. From the government's own data, people with COVID report an average of 3 to 4 contacts each. So this would represent 50 to 60,000 contacts who weren't identified, asked to isolate, and therefore will have continued to spread the virus. While up to 10 days has lapsed and the opportunity to prevent onward spread may have been missed, he mentions 51% of cases have been contacted, but what timescale does he hope to reach all the contacts of those cases? And given only about 60% of community contacts in England are currently reached, will he involve local authority public health teams in what is now a massive contact tracing operation?
Thank you very much. Well, to the core of her the Honourable Lady's point, the assessment of the epidemic on the basis of the updated data is core to our approach to tackling the epidemic, and the Chief Medical Officer has analysed that, the new data, which we've now published. So on the coronavirus.data.gov.uk website, you can see the data, and that's on the corrected basis. And based on JBC analysis, the CMO's advice is that the assessment of the disease and of its impact has not substantially changed. And that's because the just under 16,000 cases were essentially evenly spread. So it hasn't changed the shape of the epidemic. It has changed the level in terms of where we're finding the epidemic and in what sorts of groups. She asks about how many contacts have been contacted as opposed to how many of the primary index cases. As I said, that is happening concurrently. So as soon as the index case has been contacted by test and trace and has been interviewed, then the contacts are immediately contacted. And as I say, we've got through 51% of the backlog over the weekend, and we've brought in more resources in order to complete that task.
Ray Clark.
Thank you, Mr. Deputy Speaker. My right honourable friend and everyone in the House hopes that there will be a safe and effective vaccine available during the months ahead. But the head of the Vaccines Task Force has said that she expects it to be available to only half of the population, concentrating on the over 50s and the most vulnerable. Is that the Secretary of State's understanding, and what are the implications for the other half of the population?
Well, this is a very important question, and the Vaccines Task Force has done incredibly important work in supporting the scientific development and manufacture of vaccines, and in procuring vaccines, 6 different types of vaccine from around the world. The work of deploying a vaccine is for my department, working with the NHS and the armed forces, who are helping enormously with the logistical challenge. And we will take the advice on the deployment of the vaccine based on clinical advice from the Joint Committee on Vaccinations and Immunisations. And the chair of the Select Committee will know that 10 days ago, the JCVI published a draft prioritisation, and they will update that as more data becomes clear from the vaccine. That is the government's approach to take clinical advice from the JCVI.
Jeff Smith.
Thank you, Mr. Deputy Speaker. South Manchester, the Secretary of State will know, now has some of the highest infection rates in the country, but the figures are skewed by the very high rate amongst 17 to 21-year-olds, and many of those appear to be students who are confined to halls of residence, and therefore the spread of the virus ought to be contained. So can I ask for an assurance from the Secretary of State that we won't have any extra lockdown local restrictions in Manchester as a result of figures that give a misleading picture of the extent of the virus in the wider community?
Yes, Mr. Deputy Speaker, the honourable member makes a really important point, and this is why I resist the temptation to set a simplistic threshold above which a certain level of action is taken. And that's because there might be an incident. I mentioned there might be an incident in a workplace, for instance. There might be an incident within halls of residence where you might get a very high number of cases, but if it's confined and not in the wider community, you wouldn't want to take action to restrict the social activity of the wider community. So that has to be taken into account, along with the data on the number of cases, the positivity, because the number of tests that you put in affects that as well. And we take all of these things into account, both in asking when an area needs to have more restrictions applied, and when we can take an area out of restrictions, which, of course, is so important for everybody living there.
Sir Bernard Jenkin.
Thank you, Mr. Deputy Speaker. Nobody can possibly doubt my right honourable friend's utter commitment to doing his very best in these circumstances, and indeed the goodwill and hard work of his officials. But this is another incident which further undermines public confidence in the delivery of the government's COVID response. And It is another example of where logistics and planning have let us down. And why can't the government learn from previous successes with the Nightingale hospitals and with PPE, where the military were brought in much more overtly to deal with the logistics and planning and delivery of those programmes, and they should do so on test and trace as well?
Well, of course, they are involved, but this specific issue was in a PHE legacy computer system, which we'd already identified needed replacing, and I'd already commissioned the replacement of, and that replacement is currently being built. So, we knew that this was a system that needed replacing. That work is underway at the same time as the remedial action to of course, sort the problem more immediately.
Video link. Stella Creasy.
Thank you, Mr. Deputy Speaker. We have lost a vital week in the fight against the spread of this virus in our country because of a problem with spreadsheets that the Health Secretary tells us they knew about in July. And we are paying £12 billion to these private companies to run this service. And yet the Health Secretary has told us there are no penalties to these companies for poor performance. Who is going to get our money back, Mr. Deputy Speaker? And who is going to take responsibility? Can the Health Secretary tell us where on earth does the buck stop?
Thank you, Mr. Deputy Speaker. Well, of course, I've come to the House to be clear and transparent to the House and to the nation as to the nature of this particular problem. I think it is wrong, though, constantly to be picking on a small number of the many, many cogs in the wheel that we have of this system. As it happens, this particular system was a PHE legacy system. And although that doesn't quite fit the Honourable Lady's narrative, that is the factor of the matter in this case. And I like the Honourable Lady, and she and I have worked together in the past, including on issues like this. She's normally incredibly reasonable and sensible, and I'd be very happy to ensure she gets a full briefing on this one, and any further questions she's got, I'd be very happy to answer.
Oh, that went well. Miriam Cates.
Mr. Deputy Speaker, I want to thank my right honourable friend, his department and the many thousands of people who've worked so hard throughout the pandemic to make sure that our NHS has not been overwhelmed. But an inevitable consequence of this is that a large number of elective operations have been delayed, including joint replacement surgery. And sadly, this means many people, including some of my own constituents, are living in severe pain whilst waiting for procedures. So I wonder if my right honourable friend could set out the NHS's plan to make sure people get this life-changing surgery as quickly as possible, and could some of the welcome additional resource that's been announced be used for some post-op rehabilitation?
The short answer, Mr. Deputy Speaker, is yes, and my honourable friend makes a really important case. The restart of the elective operations within the NHS is now proceeding apace. Of course, the more we can keep the virus under control, the easier that restart is. But in any case, the NHS has done a huge amount of work over the summer to try as much as is possible to separate the NHS into what are called COVID green areas, where we have a high degree of confidence there isn't any coronavirus, and COVID blue areas where there may be, so that people can get the long-term elective work done that's needed, and that will include an expansion to rehabilitation. She might have seen that one of the list of 40 hospitals that the Prime Minister announced was the DNRC, which is the National Rehabilitation Centre, to be built just outside Loughborough.
Video link. Andrew Gwynn.
Over 2 months. Yet we've now got some of the highest...
Andrew, can you hear me?
I can hear you.
Please start the question again.
The majority of Greater Manchester has been under local restrictions now for over 2 months, yet we've now got some of the highest rates in England. The test and trace debacle once again shows that the national system is broken and his measures aren't working. He knows the Greater Manchester authorities are keen to adopt a more localised approach. So if the newspaper reports are right that we're going to get a new tier system, Isn't this the right time for the government to give local areas the control over test and trace systems supported by extra financial resources?
Thank you very much, Mr Deputy Speaker. Well, I half agree with the Honourable Gentleman. It is important that we put more testing resources into the areas where cases are high, and it is very, very important that we continue to strengthen the local engagement with the national system. And I was talking to the Mayor of Greater Manchester about this only this morning. The challenge is that you also need the scale of the national system so that where there's an outbreak, you can bring huge amounts of resources to bear and make sure we can really target the support, for instance, for contact tracing. So it's the combination of the local and the national that's going to get us through this.
James Davis.
Thank you, Mr Deputy Speaker. Since Thursday of last week, under Welsh Government local lockdown measures, 500,000 people in North Wales have not been allowed to cross often meaningless county council boundaries without good reason to do so. This is causing huge disruption to livelihoods and well-being. So will my right honourable friend outline his understanding of the scientific evidence for restrictions on travel such as this?
Well, my honourable friend raises a very important question, which I know is exercising people who live within North Wales and on the border. I'm not going to criticise the Welsh Government with whom we work closely, but I would say that in England, when we choose to bring in measures restricting travel, we do it with strong guidance at the moment rather than within the law. And part of the reason for that is that there are all sorts of reasons that people might need to undertake a journey. So even where we advise people to minimise unnecessary travel, we do that by guidance, and by the large part, people follow it.
Patrick Grady.
Thank you, Mr Speaker. Mr Deputy Speaker, the First Minister said on Friday that work was underway to improve the interoperability of the two test and trace apps, and I wonder if, because they don't both work at the same time, as I've found out to my own experience, so I wonder if you can say a little bit more about how discussion between the Scottish and UK governments is progressing, and if there's some sort of timescale for allowing the two apps to work together.
Yes, I'm delighted to have the chance to agree wholeheartedly with the First Minister of Scotland. We've been working closely together to make sure that the apps in different parts of the United Kingdom work together and interoperate. That upgrade is expected in the coming weeks. We're working on it very hard and very constructively between the two different governments.
Andrew Mitchell. Mr Deputy Speaker, may I thank my right honourable friend for the way he has worked so closely with us in the West Midlands. He knows that I'm in favour of community solidarity and good sense, first and foremost, rather than legal diktat and government fiat. And will he commend those universities who have already introduced student responsibility agreements as a way of furthering all of that? And will he bear in mind this week, later on this week, that our highly effective Mayor, Andy Street in the West Midlands, the Labour leader of Birmingham City Council, and I are all of one mind, together with Justin Varney, the excellent head of public health in Birmingham, that the current level of infection rates mean there should be no further changes there this week?
Well, thank you very much, Mr Deputy Speaker. I concur with him on the importance of personal responsibility, that we all have a responsibility in this virus. I hadn't heard of responsibility agreements with students, but I think that is a very sensible approach. I spoke to Andy Street this morning, and he made clear to me the need to work together, national and local government, which is working very effectively across the West Midlands, across party lines, exactly as my right honourable friend says. And we must continue to do that as we monitor the developments and monitor the data and do all we can to keep this virus under control.
Munira Wilson.
Thank you, Mr Deputy Speaker. Some local authorities are reporting that up to 500 unexpected positive cases have been downloaded to their system. Some are 2 weeks old and have had no contact at all from the national system. Directors of Public Health are angry and they're frustrated about the lack of joined-up working and the fact that the national system continues to break, despite his and Baroness Harding's promises to go for a more locally led approach. So when will he start to work better with local authorities and have a more joined-up approach, harnessing their expertise?
That's exactly what we're doing, absolutely. And for instance, this morning I also spoke to Sadiq Khan, the Mayor of London, about how we continue to strengthen the join-up between the national and local approaches. I entirely agree with her that it's incredibly important.
Dr. Luke Evans. Thank you, Deputy Speaker. Until we get a vaccine, the House knows that it's following the rules of hands, face, space and get a test. But my right honourable friend will also know that there are different types of tests out there. So I'd like him to comment on the plans for future testing and what updates he might have. We've heard talk about salivary testing, finger prick testing, all that possibly may allow individuals to be able to deal with COVID themselves. Thank you.
Yes. We're doing a huge amount of work to trial these next generation tests at the same time as expanding the current testing capability. For instance, wouldn't it be easier if you have to have a test, Mr. Speaker, if you just need some of your saliva rather than to have to put the swab all the way up your nose and down the back of your throat? These sorts of improvements in technology are in the pipeline, and we're working incredibly hard to bring them to bear as soon as possible.
Liz Twist.
Thank you, Mr Deputy Speaker. The local authorities in the North East have put forward a proposal to be able to provide a test and trace service regionally. After this latest fiasco, will he now agree to pick up that offer of local testing and tracing and fund the local authorities in the North East to provide this?
We put an extra £10 million to the local authorities in the North East to support the contact tracing, and we also are stitching together the data feeds between the national system and each of the individual local authorities in the North East, and it's a project that we'll keep working hard on, and I'll keep listening to the needs of the local authorities in the North East and across the rest of the country.
Neil O'Brien.
Thank you, Mr Deputy Speaker. It's good that we are now testing more than other countries, and it's good that we've got a quarter more testing capacity than we did in August. And we're very grateful to the staff of the mobile testing centres that we now have in Erdby and Wigston. But what is my right honourable friend doing to further drive up testing capacity so that we can stay ahead of this?
Well, that is the subject of a huge amount of government effort and working with the NHS, working with the private sector, both on the current technology and the new technology. Mr Deputy Speaker, I just make a point about Erdby and Wigston in my honourable friend's constituency. People often, people say, where is a local lockdown having an effect? Well, the answer is Erdby and Wigston. Where the case rate has come down because the good people of Erdby and Wigston have followed the locally applied rules and it's brought the virus back under control. And I'm very grateful to my honourable friend for the leadership that he's shown there, along with the leader of the County Council and of the District Council, who've worked really hard together to make this happen.
Karen Buck.
Mr Deputy Speaker, despite all of the billions that have been spent on testing, we learned at the end of last week that the testing levels in London fell by 43% on the week before. There is also a staggering variation in capacity. In my own borough, Westminster has one of the lowest testing rates in London. Given that the limited testing capacity means that it is being directed to those with the highest rates of infection, isn't there a very real risk that this will mean we don't know what is going on accurately across the country because areas that are not getting enough testing are not showing transmission, therefore we can't make good decisions? When will we have the testing capacity to allow us to make the right decisions for our people and our economy?
Yes, the Honourable Lady makes a really important case. Firstly, as she implied in a question, of course we have to put the testing capacity into the areas of the biggest outbreaks to tackle those outbreaks. And I think everybody understands that. At the same time, we've got to increase testing capacity, and we're doing that. But the third point is, if an area has lower testing than another area, we have to make sure that we take that into account when you look at how serious the problem is. And we do that in two ways. The first is the positivity rate, so what proportion of tests come through positive. And the second is the survey data, and in particular the ONS survey, which shows that rates in London are higher than some parts of the rest of the country, like the South West, the South East and East Anglia, but not as high as in the Midlands and the north of England, or indeed Scotland, Wales and Northern Ireland. So we've got to look at the surveys, we've got to look at the positivity, as well as, of course, the basic case rate.
Aline Cairns.
Thank you, Mr Deputy Speaker. can I recognise my right honourable friend's focus and attention and efforts in relation to responding to the ever-changing COVID situation? And in this, does he recognise that there are currently a myriad of different forms of restrictions across the different parts of the country that can become confusing? Therefore, what consideration has he given to simplifying the approach to the restrictions? And in doing so, would he ensure that any simplification applies to every part of the UK?
The short answer is yes. I think that the proposals that we are working through and that I'll bring to this House, Mr Deputy Speaker, to have a more simplified approach to the local action that's needed. We have shared that approach with the devolved administrations, and indeed I've discussed it with Vaughan Gething, my opposite number in Wales, and it is the sort of approach that would simplify further were it undertaken across the UK. But of course that's a decision for the Welsh Government in Wales and for the devolves, because public health decisions are devolved. But I would urge the Welsh Government to work, well, they are working with us, and I'd urge my right honourable friend, who's a very strong voice in Wales, to try to persuade the Welsh Government to take that sort of approach right across the whole of the Principality.
Jonathan Edwards.
Diolch, Mr Deputy Speaker. Increasing evidence indicates that so-called long COVID is impacting around 10% of those contracting the virus. So what assessments have been undertaken on the potential long-term social and economic impacts of long COVID, as well as lasting pressures on health and care systems?
Mr Deputy Speaker, we have three Voices of Wales in a row, and including you, sir. And I couldn't agree with the honourable gentleman from Plaid Cymru more. The impact of long COVID can be very debilitating for people for many, many months. And some people who caught COVID in the initial peak still suffer from long COVID symptoms. And we have instituted more research. We've started in England, at least, a long COVID service within the NHS. And just today, the National Institute of Clinical Excellence has published an approach to assessing long COVID, which I would recommend to him. That is an approach that clearly is going to need continued effort so that we can make sure that people who suffer from long COVID get the support that they need.
Cat Smith.
Thank you, Mr Deputy Speaker. On Friday, I and my constituents learned via the local media and press reports that there are government plans to close the hospitals in both Lancaster and Preston, with plans to replace them with a super hospital, which would have obvious implications for other Lancashire hospitals like Chorley and Blackpool Victoria hospitals. Because closing 2 hospitals in Lancashire to build 1 super hospital does not make it easier for my constituents or the people of Lancashire to be able to access vital medical care. So can I ask the Secretary of State if he believes, as I do, that next time we hear a government minister talk about building 40 new hospitals, it should come with a health warning that that also means closing 80 hospitals?
I invite the Secretary of State to answer that, and I'm going to give some flexibility. Please, could you make sure that your questions relate to the statement that has just been given? Secretary of State.
As well as responding to coronavirus, Mr Deputy Speaker, we also need to ensure that we invest in the physical infrastructure of the NHS. And I would just correct the Honourable Lady, because the proposal in her part of the world is to consult on whether 1 or 2 hospitals are the right approach and the right thing for her part of the world, and I would encourage her to welcome the massive investment in the NHS in Lancashire, as across the country, which is going to improve care right across this land.
Thank you, Mr Deputy Speaker. I'd like to thank my right honourable friend for the huge investment in West London hospitals announced on Friday. But can I ask, with regards to coronavirus, should we not focus as much, if not more so, on the hospitalisation rate as opposed to the incidence rate, since often people do not have symptoms or have very mild symptoms, and certainly in London the hospitalisation rate is a fraction of what it was in April?
Mr Deputy Speaker, of course the hospitalisation rate is a very important factor that we look at, and it's a concern. Unfortunately, the latest hospitalisation rate has risen to 422, which is the highest since the middle of June. Of course, hospitalisations tend to lag the number of cases because people catch the disease and then are, sadly, some of them are later hospitalised. So we keep a very close eye on the hospitalisation rate. The bad news is that it is sadly going up.
Video link. Bill Esterson.
The 6 councils in the Liverpool City region face a budget shortfall of £150 million. On Thursday, the Health Secretary announced £7 million to be split between the Liverpool City region and 3 further councils. It is a drop in the ocean compared to £150 million. The Health Secretary knows that local professionals have solutions to the problems of test, trace and isolate. He's shown there's not just millions of pounds, but billions available for Serco, Deloitte, Compass and friends. So when will he invest in local public health teams and sort out the mess of test, trace and isolate once and for all? Thank you, Mr Deputy Speaker.
As I said, we have been putting that extra money into local councils as well as using all sorts of, frankly, all the tools at our disposal, public or private sector. If you're in the NHS, in PHE, in a local council, or a firm that can bring capability to bear on this problem, and it's one big team effort.
Selwood.
Mr Deputy Speaker, talking of tools at the Right Honourable Friend's disposal, Bournemouth University stands ready to help with lab testing, but it's COVID testing in schools that I would like to address, because today the rules state that entire year groups must stay out of school for 14 days if one of the pupils in that year group tests positive. And of course this causes huge disruption not only to learning but also to working parents who have to provide childcare. So could I ask the Secretary of State, with better testing systems now in place, please can we review this 14-day rule that sends an entire year group home so we can both keep our children safe but also in school?
I would love to be able to review that, but only when it's clinically safe to do so. But I would just point out, both to my right honourable friend and also to all of those in education and in schools across Bournemouth who are following this, that you do not necessarily have to send the whole year group home. You have to send the bubble home, and you can, by ensuring that the way that the school operates. By ensuring the way the school operates keeps people safe, you can ensure that bubbles are smaller than the whole year group, and many schools do that. So I think the first port of call immediately would be to try to get the bubbles smaller within the school, and then, of course, absolutely, we should work together on other ways to solve the problem.
Robbie Moore.
Thank you, Mr Deputy Speaker. I do not underestimate the scale of the challenge in ensuring we have enough tests for everyone who needs it, and it's incredibly encouraging that testing capacity has increased by 25% since the middle of August. So can my right honourable friend assure me that he continues to work to get that testing capacity up even further so that venues like Victoria Hall in Keighley can meet demand?
Yes, absolutely right. The testing capacity now stands at over 300,000. We're on track to reach 500,000 by the end of this month. I know what a goal for expansion of testing capacity feels like. This is a tough and difficult challenge, but the team are rising to it. And Mr Deputy Speaker, I'd just say that within Keighley, my honourable friend has really made the case for Keighley so strongly during this pandemic, and he continues to make it in terms of the extra testing capacity that's needed there now.
Alison McGowan.
Thank you, Mr Deputy Speaker. However basic this data error may have been, the consequences are very serious. But I want to say to those civil servants working night and day to get this right, the responsibility for this is not on you. It is on those who guarantee the checks to the system. As the Secretary of State has indicated, that is him. So with that in mind, can he avail himself of any data process flowcharts or other diagrams relating to the processing of this data, and all data quality assurance policies and processes, and put those in the public domain? Yes or no?
Well, I'm very happy to work with the team to see what we can put in the public domain. The challenge of a maximum file size error is that it wouldn't necessarily have appeared on one of those sorts of flowcharts, itself, given the massive expansion of the availability of data storage over recent years, would not, I would expect, be a feature of the replacement system that we're already in train to bring in to replace the system that caused the problem this weekend. But I would just wholeheartedly agree with what she said about the civil servants in the department and staff at PHE who are working so hard during this pandemic.
Wigan.
My honourable friend gave an excellent answer to the honourable member for Tunbridge Wells. The JCVI report is indeed most helpful and reassuring because it prioritises the vulnerable, the elderly and, of course, our health workers. However, it last met on the 1st of September and the report is dated the 25th of September. Can he confirm that if there is more information on the progress of the vaccine, that committee will meet again and will get another excellent report?
Yes, absolutely. When people are asking questions about how the vaccine will be rolled out, and of course I understand why people are so interested in that, we will, of course, protect the most vulnerable first, and we'll do that on the basis of clinical advice, and the JCVI brings together the best clinicians in this area. Of course it meets very regularly, and decisions of the JCVI will not be on the critical path to the rollout of the vaccine. I've been assured of that.
Video link. Debbie Abrahams.
Thank you, Mr. Deputy Speaker. One of my 15-year-old constituents had a COVID test over a week ago, and in spite of chasing, is still none the wiser as to whether she has COVID or not. Not only is she having to self-isolate, but her mum, a nurse, is also having to take the precaution of self-isolating, something she says her ward can ill afford. On top of this, Mr. Deputy Speaker, last month, the time taken to get test results back from the National Test and Trace programme, the Oldham's public health team, to enable them to trace the cases the national programme is failing to get in touch with, was 12 days. 12 days, not 24 hours. So will the Health Secretary please tell my constituents how many of the 16,000 or so lost test results were from Oldham, and how many contacts, not cases, have not yet been traced?
Thank you very much, Mr. Deputy Speaker. Well, of course, the good news is that the turnaround time of test results has been coming down. I'd love to see to take up the case of the individual who hasn't had a result back as she described, because that is rare. The majority of cases come back now the next day, and that's good news. I'll specifically be looking to turnaround times in Oldham, because an average of 12 days seems a lot longer than I expected, and I'll make sure I get back to the honourable lady at the appropriate opportunity.
Croft.
Thank you, Mr. Deputy Speaker. Speaking to local people, it has become clear that there are still concerns about routine appointments, GP appointments, and increasingly routine dental care as well, which is obviously really important to prevent future problems down the line. Can my right honourable friend tell me what plans he has over these potentially bumpy next few months to ensure people are still able to get those appointments?
Yes, well, for all my enthusiasm for technology, and that enthusiasm is huge, the need for people to have a face-to-face appointment with their in primary care at their GP surgery, if that's needed, is obviously critical. And every GP practice should, of course, offer those face-to-face appointments where they're needed in a COVID-secure way. We've made that clear. The vast majority of GPs are doing incredible work and offering the public the service and the vocation that they went into medicine for. If my honourable friend has specific examples, I'd be very happy to look into them. But overall, it's so important that we keep primary care running.
Video link. Barry Sherman.
Mr. Speaker, my former student, thank you. could I say to the Secretary of State that we're talking about human beings here, working systems, and I warn him that there will be more glitches. Technology means glitches. So I'm worried about him because we've got a long, hard winter. But can I ask him, does he agree with me that what we're doing in Huddersfield and Kirklees is working together as a council, as a local university, as a local health trust, working together, putting party political issues to one side. This is what we must do this winter. A long, hard winter. We've got to beat this virus, and we've got to work together in order to do that.
I agree with every word that my honourable friend said.
Aaron Bell. Thank you, Mr Deputy Speaker. Firstly, could I welcome the new centre at Keele University campus in my constituency, which opened last Friday, and thank his department for that. But secondly, he may be aware of the article in the Times on Saturday suggesting people were having difficulty accessing tests in the centre in Newcastle-under-Lyme itself, which had been walk-up in August but now requires booking. The article suggests there's plenty of capacity at the centre, but there's not yet enough at the labs. So could he confirm this government is still committed to 500,000 tests per day by the end of this month?
Mr Deputy Speaker, we're committed and on track to the delivery of 500,000 tests by the end of this month. We have capacity at over 300,000 now. I saw the article in the Times newspaper. Of course, one of the good things is that in Newcastle-under-Lyme, the case rate had come right down, which meant that we had a walk-in centre because it was an outbreak area, and it stopped being an outbreak area because everybody in Newcastle-under-Lyme did their bit and brought the case rate down. And so that's a good thing, of course, but it does mean that we have to make sure that the testing is targeted at where it's most needed across the country. But what I really want to do is have that extra capacity that we're building so everybody everywhere can get it.
Video link. Barbara Keeley.
Thank you, Mr Deputy Speaker. In Salford, the case numbers have now risen above 250 per 100,000. As well as this case uploads programme issue today, our local contact tracing programme is having to wait on average 4 days for data from the national system, and in the worst cases 7 to 9 days. Now that's creating an unacceptable delay to contact tracing. In August, Baroness Harding said that we would have a contact tracing system which was local by default. So what is he doing to make sure that data gets to local authorities in a timely way so that they can be followed up by genuinely local contact tracing systems under the control of our local directors of public health?
This is the goal as she sets out, and reducing the times for those transfers is very important. And making sure that the transfers happen effectively and in an automated and cohesive way is very important. But the approach that she sets out of using the national system to to do the first attempts at contacting people, contact those who it's easy to contact, and then use the local system to contact those where it's more difficult, where the boots on the ground can help. That's the approach that we're taking to make sure that we can get that join up as effectively as possible.
Jane Stevenson.
Thank you, Mr Deputy Speaker. I'd like to thank the Secretary of State for working so constructively with Wolverhampton City Council when they requested some limited local restrictions around households visiting other households in their own homes. As we move forward to get the virus down, can we give further advice on how we all can limit transmissions within home settings, especially where we have a vulnerable family member?
It is so important that people follow this guidance. And of course, the first principle for everybody needs to be hands, face, space. And keeping a distance, if possible, within households if somebody tests positive. And the other thing not to underestimate is the importance of cleaning, because this virus passes on through the air, but it also passes on surfaces, and we should all be aware of that.
Video link. Dan Jarvis.
Thank you, Mr Deputy Speaker. It was good to see the Secretary of State earlier today, and I very much hope that he'll keep talking to local and regional leaders. As the Secretary of State well knows, the winter months are always the toughest for patients and for staff. This one could prove to be the most challenging that our NHS has ever faced. So can I ask the Secretary of State to guarantee that the NHS will have the funding and resources needed to get it through this winter?
Well, I welcome the very constructive approach that the honourable gentleman takes in his local role, as well as in this House. And of course, we've put in the extra funding that the NHS needs this winter. We're expanding over 140 emergency departments, because emergency departments need more space so there could be social distancing. We've also put in funding so that we can continue the work on electives, even though it's more difficult, and on infection control, and of course, as much discussed, on testing. And I look forward very much to working with him further as we try to control this virus.
Salute. Can the Secretary of State confirm that the Rule of Six and curfew are based on the evidence of what worked in Belgium? And will he continue to provide the whole country with the evidence of what has worked internationally, so we can take the whole country with us to defeat the pandemic?
My honourable friend makes a very important point, which is we've got to learn from things that have worked in other countries. We're constantly looking around the world, as well as at the domestic science. And I'm very happy to work with him to see what further we can publish in terms of the assessments that are made and then presented to us as ministers to make decisions on that constitute that scientific advice.
Emma Bug.
Thank you very much, Mr Deputy Speaker. It's clear that local lockdown areas should have control of test and trace. Yet at the weekend, the Prime Minister was adamant it wasn't failures with his world-beaten system that's impacted on our local increases, but that my constituents are just undisciplined in following his confusing and incoherent messaging. Does the Secretary of State share the Prime Minister's insulting view?
I think it's incredibly important. I think it's incredibly important as leaders in our local area that all of us reiterate the public health advice that people should follow the rules that are put in place for a reason. Nobody wants to have these rules in place, but they are important to keep us all safe.
Selene Saxby.
Thank you, Mr Deputy Speaker. I recognise the scale of the challenge in increasing testing capacity, and in Devon this has increased by over 40% since the start of September. Can my right honourable friend assure me that work continues to rapidly get that capacity up even further so constituents in my North Devon constituency are able to get tested?
Yes.
Richard Thompson.
Thank you, Mr Deputy Speaker. In the Minister's statement, he said that 51% of the cases have now been contacted a second time for contact tracing purposes. Can the Minister clarify how many people are still waiting to be contacted for a first time, and how can the Minister say with any confidence that the notification process for those individuals hasn't been delayed?
All of the 15,000 have been contacted for the first time.
Tim Farron.
Thank you, Mr Deputy Speaker. In the Secretary of State's statement just before, he spoke with pride about the Prime Minister's announcement on Friday of the additional capital programme for hospitals. I have to say that in Cumbria, we met that announcement with some dismay. As my honourable friend from Lancaster spoke earlier on, there is a proposal in there to close the Preston and the Lancaster hospitals and to merge them into a single hospital somewhere in between. I wonder if the Secretary of State realises that will mean even longer journeys for acute care for people from the South Lakes. Will he have a word with the Prime Minister then and drop this dangerous proposal from the consultation so that people in South Cumbria do not have to make dangerous journeys for emergency care?
This was only touched on in the statement. This is a COVID, it touched on briefly, but it's a COVID update, and it would have been really nice if you could have done it in relationship to the COVID update, which is what basically the statement was mainly about. It was only touched upon. Secretary of State.
Thank you very much. Well, as part of the coronavirus response across Lancashire and Cumbria, we want to make sure also that the NHS is prepared for the long term, and so we're putting a huge investment into Lancashire and into the new hospitals in Lancashire. And as he almost mentioned that there is a consultation on whether to have 2 replacements or 1. I entirely understand that he takes a position within that consultation, but I think it's worth just explaining that there is a consultation on whether to replace with 2 or one hospitals, and there will rightly be full public engagement with his constituents and the honourable ladies and indeed potentially yours, Mr Deputy Speaker, on which is the right approach to go. But this is a massive investment in the local NHS that everybody should welcome.
Video link. Peter Byrne.
Thank you, Mr Deputy Speaker. Can I thank the Secretary of State for coming to the House yet again to update the House on COVID matters and health matters. And he's quite right to concentrate, of course, today on COVID, but we've also got to worry about people who have not got COVID diseases who need treatment. And therefore, in North Northamptonshire, can I say how welcomed we are that a Boris Hospital is going to be built just off the A14, which will be state-of-the-art and replace the town centre one of Kettering. And could the Secretary of State tell me when it's going to be built and when it's going to be finished?
Yes, Mr Speaker, as part of the coronavirus response, we must ensure that we keep our physical NHS up to date, and we will build the new hospital in Kettering. We will complete it before 2030 at the latest, and I very much hope a long time before then. I just want to say how much my honourable friend has done to work towards delivering this, along with the members for Kettering and Corby nearby. It's been a team effort, and I was absolutely thrilled to be able to let them know that this is happening, and it will happen before this decade is out.
Lots of opportunities to question the Secretary of State about the new hospitals at a more appropriate time. Video link, Richard Bergen.
Thank you, Mr Deputy Speaker. In the past 14 days, New Zealand's had 35 coronavirus cases, China, Hong Kong and Macau 260, Vietnam 28, Thailand 84 and Australia 238 cases. The UK has had 108,000 cases. Our coronavirus strategy is failing. Others show we can fix this and get the test and trace system our people need. So will the Secretary of State do what's needed? Kick out Serco, sack Dido Harding and put the billions of pounds wasted on private companies that are failing into our NHS that will do the job properly?
No.
Kate Griffith.
Thank you, Mr Deputy Speaker. Does my right honourable friend agree with me that hospitals such as Queen's Hospital in Burton should be doing everything that they can to reintroduce access for birth partners of pregnant women during all stages of labour, and that this should be treated as a priority?
Yes, I do, Mr Deputy Speaker. Coronavirus brings many challenges, and making sure that we have good infection control during not just during childbirth, but during the meetings that are often so critical during pregnancy. It's very important. We changed the guidelines a couple of weeks ago, and I know that everybody across the NHS is working their best to get the best outcome, and I hope that we get there soon.
Neil Coyle. Thank you, Mr Deputy Speaker. It's 9 months since the World Health Organisation first warned of the risks COVID posed. My constituents in Southwark deserve to know the government is trying to keep them safe and that they can get tested or traced if needed. Why has no other government in the world experienced such problems with Excel spreadsheets? And why won't the Secretary of State take responsibility for this latest world-beating incompetence?
Funnily enough, when I speak to my colleagues from across the world, we all have many of the same challenges, including the need to get the testing capacity up. And he may not believe me, but occasionally they ask me what we've done to expand testing capacity quite as much as we have. And I'm very happy to explain that both to him, his constituents, and the rest of the House.
Thank you, Mr Deputy Speaker. Can my right honourable friend confirm that his statement today does not impact the decision to keep Redcar and Cleveland, Stockton and Darlington out of local lockdown restrictions? And does he also see that more testing surely means more positive tests? So should we now be looking at numbers admitted to hospital instead of COVID case numbers before we consider further lockdown restrictions in local authorities?
Mr Speaker, my honourable friend makes an important point. The first thing is that, as the Chief Medical Officer has confirmed, this issue does not affect the decisions that were taken last week. But of course, we look at all those decisions each week. And as he knows, we take as localised approach as is possible. So rather than bringing in measures for the whole of Teesside, we brought in measures for Middlesbrough and Hartlepool, where the local councils had called for them, whether or not they mentioned that afterwards. What I'd say to him is that we should keep working together. We should keep making sure that we look at that data, of course the hospitalisation figures, as well as the test positivity, and of course the number of cases. Hospitalisation data is important, but it does follow with a lag, and so you've got to look at the early indicators as well.
Video link. Rosie Cooper.
Thank you, Mr Deputy Speaker. Constituents in West Lancashire are worried, as I've got constituents who were told they tested positive on Friday and they still haven't been contacted by Track and Trace nor the restaurant they work in. And they worry that this is increasing the danger of the spread of COVID. They're also worried that we had a stockpile of drugs held in the event of a no-deal Brexit, and that may be being reduced because of this pandemic. Can the Secretary of State update us on both those things?
Mr Deputy Speaker, on the first of those, of course, all those who tested positive received that result, and with it, that brings a duty under law to self-isolate. And that is the primary way that we keep people safe. And that worked through this. As I said in my statement, as of 9 o'clock this morning, 51% of those had then been contacted for contact tracing purposes, and I very much hope that the constituent that she mentions will be contacted very soon, if not already. On the final question that she asked, of course, we have been replenishing the stockpiles of drugs that we used up during the peak. That's been a very important part of the work over the summer as we prepare to leave the end of the transition period at the end of this year.
Holden.
Thank you very much, Mr Deputy Speaker. And I'd like to thank the Secretary of State for his continued engagement throughout this crisis with me and other colleagues from all sides of the House. And also for our new Boris Hospital coming to Shotley Bridge as well. But my constituents have three concerns still. One is the speed of getting tests back. And I know there's been some improvement recently, but if you could update us a little bit on that. And also, they're still concerned a little bit about the 10 p.m. restrictions and also the clarity of how we're going to get out of these local lockdown measures. So could he inform us a bit more about that?
This coronavirus crisis is not easy for any health secretary, but it was a joy to be able to call the honourable gentleman and tell him that we are rebuilding Shotley Bridge Hospital on the site of the old steelworks. It's going to be absolutely fantastic, like a phoenix from in the heart of County Durham, and it's a joy to work with my honourable friend. He asked important questions about coronavirus. Mr Deputy Speaker, as he says, we are reducing the turnaround times for those test results, and we'll continue to work to try to make those as fast as possible.
Video link. Emma Hardy.
Thank you, Mr Deputy Speaker. Will the Minister please outline what measures will be put in place to ensure that all family members of residents in care homes can continue to see their families and loved ones over the coming months, including whether they will guarantee PPE and testing for families?
The Honourable Lady has taken a close interest in this very important subject repeatedly. We have put in place updated guidance on visiting care homes, which is a very important and sensitive balance that we need to strike, working with local directors of public health. I can't give the guarantee that she seeks in all areas because it is a matter for the judgment of the Director of Public Health locally, because in some parts of the country the virus is more prevalent than elsewhere. I wish I could, I can't, and I look forward to continuing to work with her to try to get that balance right.
Tom Randall.
Thank you, Mr Deputy Speaker, and I do welcome the news that the QMC and City Hospital are going to be rebuilt in Nottingham. But on the subject of PPE, the Minister of Health told the PACAC Select Committee in July that in the early days of the pandemic, the government went from supplying 250 or to 260 hospitals to 58,000 organisations. Such was the pace of change. So with the measures that the government's taken recently with the 32 billion pieces of PPE export, can my right honourable friend assure me that the government's now in a much better position to deal with PPE, should there be any increase in cases as we go into the winter?
Yes, absolutely. The PPE distribution system was described by the head of the armed forces as the biggest logistical exercise he'd seen in his professional lifetime, and that has been it's been a mammoth effort to get it into decent shape. But it is now in decent shape, I'm very glad to say, and we've prepared. Not only we've been preparing to solve the current problems, but preparing in case of a second peak, and we've said that PPE will be free to NHS institutions and care homes for the remainder of this financial year to remove that worry. And I just want to strongly support what my honourable friend said about the warm welcome to the rebuilding of the QMC and City Hospital in Nottingham. It's a place I know well from my family, many of whom are from Nottingham, and it's really great that we're able to put in that huge investment.
Video link. Lucy Powell.
Thank you very much, Mr Deputy Speaker. Firstly, I'm reassured by the Secretary of State's answer to my friend, the member for Manchester Withington, that Manchester won't be subject to further restrictions as a result of contained outbreaks in halls of residence. However, residents in Manchester have now been unable to see their loved ones for over 2 months, when our rates were less than 50 per 100,000. They're now 10 times higher than that. And I strongly reject the suggestion that this is because of our own personal actions somehow. So isn't it time for a rethink? Because blanket-wide local restrictions just aren't working by their own objectives. And if we're looking at another 6 months, this is no life for people to be living, and it's not sustainable or desirable.
There is a challenge where case rates are going up sharply. Of course, the virus does pass on through social contact, and we do need to work with the local councils in order to bring this virus under control in Manchester, as in other parts of the country where it's rising very sharply.
Elbrook. Thank you, Mr Deputy Speaker. Mr Deputy Speaker, on Saturday my wife and I got our annual flu jabs, and if you would just indulge me for a second, just to say that the GPs and the nurses at our local surgery are doing an outstanding job. It was pre-booked, within 2 minutes, in and out. But Mr Deputy Speaker, I don't want to make you cry, but unfortunately I suffer quite badly from vaccines, and when I had my yellow fever vaccine I thought my end had come. But is it therefore important that my right honourable friend agrees with me that people need to be aware of some of the side effects of vaccines and be crystal clear on what the symptoms of coronavirus are, so once they've had their vaccines they may not unnecessarily be seeking COVID testing, that they're absolutely clear on the 3 symptoms of COVID?
Well, thank you very much. It is too early yet to be able to set out the clinical details of vaccines, other than to say that we have a draft of the priority order for the distribution of a COVID vaccine, and that we will not bring in a COVID vaccine, and the MHRA wouldn't license it unless we're confident that it's safe. And it's at that point, when we know more about the clinical details of it, that we'll be able to say more about its effective rollout.
Ferriel Clark.
Thank you, Mr Deputy Speaker. From our broken test and trace system to the failure to put a protective ring around our care homes, and from the recent and preventable outbreaks in universities to the ultimately an unnecessary restructure of Public Health England, the chaos this weekend is symbolic of the way the government has handled the pandemic. Does the Secretary of State that these are his failures and only his alone?
Thanks very much, Mr Deputy Speaker. Responding to a pandemic is an enormously challenging task, and thankfully it's a massive team effort, and it's one in which the whole country can be engaged because we all have a part to play.
Bob Blackman.
Thank you, Mr Deputy Speaker. London consists of 32 boroughs plus the City of London and covers a population of around 8 million people. We're told that the infection rates are going up in each of the London boroughs, but some are much higher than others. Could I urge my right honourable friend to consider how, when he has a need to introduce lockdown procedures, that he does so on a borough by borough basis and not inflict unnecessary restrictions on the whole of London, which would be counterproductive in terms of delivering the pressure downward on the increased caseload. That would potentially bring the economy to a halt and also affect the way Parliament works.
My honourable friend makes an important point, and getting the right geography for any particular action is very important and a difficult consideration. The example last week of taking 2 of the boroughs of Teesside into local action, but not the other 3, demonstrates that we are absolutely prepared to do as he says, as he wishes for London. On the other hand, on the same day, we took the whole of the Liverpool City region into the same measures because that was what was appropriate there. You have to take into account travel patterns and socialising patterns, as well as the pure data from the epidemiology and the number of cases. But it's absolutely something that we look at because we want to minimise the number of restrictions that are in place, subject to keeping the virus under control.
Morris.
Thank you, Mr Deputy Speaker. The Secretary of State's full of bravado and bluster, despite a catalogue of mistakes and regular statements here. Quite often people start to see through when the truth is spread thin enough. They start to see through it. So this expression, world-beating test, track and trace system, how would Ricky Tomlinson describe it?
I don't know.
Elliot Colburn.
Thank you, Mr Deputy Speaker. And can I begin by thanking my right honourable friend, both for the £500 million for Epsom and St Helier hospitals, but also for taking very quick action after I asked in this House for additional testing capacity in Carshalton and Wallington. Not much longer after I asked my right honourable friend did we hear that 3 more sites may be opened up in my borough, and that's very welcome. But obviously these new sites need to have the testing capacity to be able to cope. So can my right honourable friend assure me that we will continue the work to get that capacity up as quickly as possible and into boroughs like Sutton?
Yes, we're bringing more testing capacity into Sutton. We've opened more testing sites in Sutton. I can tell the House that the distance travelled on average to a test has now fallen to 4.3 miles, down from the over 6 miles that it was 3 weeks ago. And we're bringing a new hospital to his area, a massive £500 million investment in the NHS, showing that we are always prepared to protect the NHS for the long term.
Thank you, Mr Deputy Speaker. Secretary of State, there are various companies that have had multi-million-pound contracts, and it's very important that we get to understand the motivation of these companies to succeed. I just wonder, does Serco get paid for voided test results, yes or no?
The motivation, as she says in her question, the motivation of my whole team, no matter how they're employed or contracted, the motivation is to beat this virus, and we're working together to do that.
Wheeler. Very much indeed, Mr Deputy Speaker. I thank my right honourable friend for his statement today. It's very important. My South Derbyshire constituents have asked me to ask, as we have world-renowned laboratories locally, what steps is my right honourable friend taking to increase the number of labs available to process tests so that we can continue to increase the testing capacity as quickly as possible?
Yes, she's right to ask this question because we're expanding the number of labs as we expand the number of tests. And I know that there's great capability in Derbyshire that can be brought to bear as part of this big team effort.
Link. Geraint Davis.
Thank you. Mr Deputy Speaker, as you know, people in Wales in lockdown aren't allowed to leave their county for fear of spreading the disease. So people in Newport with 50 cases per 100,000 can't go to Aberystwyth, for instance. But people in Manchester with 500 cases per 100,000, that's 10 times the number, can go to Aberystwyth and spread the disease and elsewhere in Wales. So will the Secretary of State, in order to stop this spreading of disease, restrict travel out of lockdown areas in England? And if he won't, would he accept that it would be a good idea to have quarantine for those people arriving in low-risk areas in Wales? Or is he happy for the disease just to spread without restriction?
The challenge, Mr Deputy Speaker, is that the primary transmission of the disease is between households and between households mixing with each other. And the approach that we've taken thus far in England since we came out of the initial full-blown lockdown has been to put travel restrictions in guidance rather than in law. Because that is that we felt that's the most appropriate thing to do. I know that's not the approach that they're taking in Wales, but that's how we are currently handling it in England.
Video link. Kenny McCaskill.
Thank you, Deputy Speaker. It was a political, not health decision to pursue a private sector route for testing. Scotland has chosen differently. But with ongoing capacity issues in England and Wales, there are concerns that it will impact upon Scotland. Will the Minister confirm that Scots won't be prejudiced by the Tory government's preference for private profit over public health?
Quite the contrary, Mr Deputy Speaker. The UK-wide testing system delivers enormous numbers of tests to people in Scotland. And I know from having studied it that people in Scotland are really grateful for the fact that we work together, the UK government delivering testing in Scotland alongside the Scottish NHS delivering testing in Scotland, and it's that sort of coming together that people look for during a time like this.
Jonathan Gullis.
Thank you, Mr Deputy Speaker. In Stoke-on-Trent, we were delighted to come off the national watch list as an area of concern after hard work from Stoke-on-Trent City Council, Staffordshire County Council and, most importantly, the people of Stoke-on-Trent, Kidsgrove and Tork for adhering to the public health messaging. Adding that, we have the regional test centre that Councillor Abby Brown and I successfully lobbied my right honourable friend for, and we have now 2 incoming walk-in test centres in Stoke-on-Trent. So will my right honourable friend, though, commit further by giving additional funding to help Stoke-on-Trent City Council and the Royal Stoke University Hospital deliver an increased testing capacity for the thousands of local health and social care workers from across Stoke-on-Trent and Staffordshire?
Yes, well, as well as the expansion of testing that my honourable friend has mentioned, I can tell him that we're expanding the NHS testing capacity within Stoke, and we're putting in the extra funding to deliver that. So this man stands up for Stoke so strongly, Mr Deputy Speaker, and he's been making the case very, very clearly and powerfully, and so I'm glad to be able to tell him that we can do that.
Stephen Doughty.
Mr Deputy Speaker, vaccines have come up a number of times during the statement today. Could the Secretary of State to be absolutely clear? Are there shortages and recalls going on of flu vaccine at the moment? I've certainly been told by a major pharmacy company that there are. And the Royal College of GPs wrote to him yesterday saying of delays of a month. And he didn't answer the question from the chair of the Select Committee. Kate Bingham was very, very clear. She said that vaccinating the population was just not going to happen on the whole population. Was she correct to say that?
On the latter point, we take our advice from the Joint Committee on Vaccinations and Immunisation, and they will provide the clinical advice. That clinical advice has not been provided yet because the data has not yet been provided to them in full from the trials that are ongoing. I couldn't be clearer about that. The government's advice on the distribution of the vaccine for clinical purposes comes from the JCVI, and I'd urge him and all others to read their report from 10 days ago, which was an excellent report. When it comes to the flu vaccine, we have enough flu vaccine to vaccinate every single person who's in a priority group over the age of 65 or who are clinically vulnerable, and the children who are eligible for it. We are rolling that out over the forthcoming months, and on Sunday I spoke to the President of the Royal College of GPs, and we discussed the need to make clear to both to GPs and pharmacists who are at the core of the rollout, and also to the general public, that this rollout, we have enough vaccine, we are rolling it out over the months to come, because it's very important that people come forward. I'm really glad they're coming forward in record numbers this year, but it does take several weeks to get that done.
I think the House should recognise that going from 2,000 tests a day in March to around 250,000 now, and hopefully seeing that double over the next few weeks, is a significant achievement. But can the Health Secretary provide any reassurance that sectors like travel, like theatre, like events, that are in so much difficulty now, can we use mass testing to help them open up again?
My right honourable friend makes a really important and heartfelt plea, and I've been working with the travel sector and discussing this with them. Of course, whilst the testing capacity is as it is now on the current technology, we have to use it for the clinically prioritised groups. But of course, we'd all love to see when further expansion can mean that we can use it more broadly in the sorts of ways that she describes.
Kevin Jones.
Thank you, Mr. Speaker. Mr. Deputy Speaker, since the beginning of this crisis, the government's approach has been one of central control. Now we're fixated on the number of tests, but isn't the real issue is not only the number of tests you do, but actually what you do with the information that you get from it. Before the new restrictions were applied to County Durham, NHS Test and Trace took out of County Durham testing capacity. Isn't it now time to just admit that this national system has failed? And what is needed, it needs to give responsibility directly to public health and the resources to do not only the testing, but actually do the more important thing, which is tracing, which they're more able to do than actually from people from national call centres.
Yes, we've put in money, including into his constituency, to do exactly that, to make sure that there is that local support. And when he says that we should follow an approach, a localised approach, that's exactly what we did with the North East. When the North East 7 councils came to national government, they asked for a set of interventions to be put in place, and we put those interventions in place. That is exactly the sort of approach that we ought to be taking and will continue to do.
Mike Wood.
Thank you, Mr. Deputy Speaker. The number of people in Dudley who are being triaged for coronavirus testing has halved in the past couple of weeks. It's hard to believe this is down to reduced levels of demand. What progress is my right honourable friend making in expanding that capacity so that my constituents in Dudley South can get the testing that they need readily and when they need it?
Now, we are expanding that testing, but Mr. Deputy Speaker, I'd also say this. In this House 2 or 3 weeks ago, the big item of discussion was the excess demand for testing, and we put out public health messaging to the public to explain you come forward for a test if you have the symptoms of coronavirus, but not if you don't. And we have seen the number of people who come forward without symptoms has fallen since then, meaning that we can get the testing capacity we have to the people who need it. And that has been a success. And I want to thank everybody, frankly, in the country who's listened to those messages. We've worked hard to get more comms out about it, and that has been moving in the right direction.
Jason McCartney.
Thank you, Mr. Deputy Speaker. COVID case data is used to decide which areas are in local lockdowns, with the impact on hospitality businesses, families visiting loved ones in care homes, and the detrimental effect to mental health of those missing out on social interactions. Therefore, can the Secretary of State assure me and my Colne Valley constituents that the data used to put us in local restrictions is up to date and accurate, and as soon as we start getting the cases down, we can then come out of local restrictions as soon as safe to do so?
My honourable friend makes an incredibly important point, which is that whilst, of course, we're vigilant and we have to bring in local action in some cases, as we have done in his area, we will then also bring areas out whenever it's safe to do so, as we did in his area, which unfortunately then had to go back in again. I'd rather places didn't come in and out and back in again in that way, but that's better than leaving the measures in place when they aren't needed, in my view. So we published that data. The data has now been updated for the issues that we had over the weekend. We will have the minimum interventions in place that are necessary to keep the virus suppressed and protect as much as possible the economy and education, of course, and the NHS until a vaccine arrives. That's the strategy. It's true in the Coal Valley. It's true right across the country. And I look forward to working with you, Mr. Deputy Speaker, and colleagues right across the House to try to help the country to get through this as much as we possibly can.
I'd like to thank the Secretary of State for Health for updating the House on COVID-19 measures and for answering questions for the last hour and a half. Thank you very much. Point of order, David Davis.
Thank you, Mr. Deputy Speaker. There's no provision in today's order paper for debating the programme motion, which is listed to be moved forthwith at 10 p.m. Now, this motion proposes the further stages of the bill that we're debating today, committee report and third reading, are moved in a single session on Thursday week. Now, this bill is described in the House of Commons brief